Well, thank you. I have to say I am absolutely delighted to be back here. I remember so clearly that announcement when we announced this project was moving forward. I then declared myself not Minister of Health, but Minister of Halton Health, because I seem to be in this area with lots of good news. I remember that announcement so clearly because I think it's the only announcement I've ever been where the audience burst out in tears. But you got your hankies. You see, that just tells me how much this means to this community. When there are people who for many, many years have been fighting for this, actually achieve this, it is a time for tears of joy. Before I talk about the new building, I really want to take a moment to give a big congratulations to the people here at Milton District Hospital for other successes. You know, before I come to an event like this, I take a little look at some of the metrics that we follow. And one of the issues that I really want to congratulate you on is your commitment to giving people faster access to the care that they need. Even though you are bursting at the seams, you have managed to bring down wait times substantially. And it's extraordinary to me that when you look at this hospital's reduction in wait times in emergency departments, you've taken a full 2 hours off how long people wait before they are, from the time they arrive to the time they leave. You've taken 2 hours off that wait. That doesn't happen by accident, and that doesn't happen easily when you've got so many more people coming to your emergency department. So congratulations on that. And where do people want health care? As close to home as possible. And that, you know, we're celebrating an important milestone. And the milestone, I really should make that announcement, shouldn't I? That the RFQ has been issued. And what that RFQ means is that companies who want to build this and maintain this will have to apply to be qualified. From that list of qualified teams, we will be choosing one, and they will proceed with shovels in the ground in 2015. And I look forward to being here for the grand opening in 2018.
The foundation exists, it has a long history, and it has a significant challenge, and that challenge will be to touch the generosity and support of this community. Now, when I think of the history of this hospital, people bought bricks. They actually bought bricks and had their name put. They were symbolic bricks. And this, more than any other hospital that I've encountered, is truly a community hospital. Its value is embraced and felt strongly by every citizen in this town, all 100,000+ of them. And this hospital was designed and built for 20-some thousand people, and now its capacity is challenged on a day-to-day basis. This will be the largest initiative taken in Milton's history. If we look down the road and see that spectacular hospital that is being constructed in Oakville, you see that simultaneously, within this lens, we have an Oakville, we have a Milton, and we have Georgetown, all active in some phase of growth, construction, and service to our collective communities. And that's a remarkable, remarkable accomplishment. We have medical staff and hospital staff who are contributing on a monthly payroll contribution. Okay. Next comes the community. And collectively, whatever that amount may be, and it will be significant, we will accomplish our role as a foundation in providing the funds to make this happen. So thank you.
I'm here today because I am the current chair of the board of directors, but I know full well, and I think we all do, that none of us would be here celebrating this event if it weren't for the passion and dedication of the people of Milton who are so dedicated to their hospital.
Forward, the minister has mentioned that the request for qualifications has been issued, so there'll be a number of consortia from across Canada and maybe even internationally that will be looking at working to design and build this hospital project. We'll be narrowing that down to three potential consortia. They will receive a request for proposal in March of 2014. We should reach an agreement with the final go-forward consortia to construct the hospital and have an agreement in around early 2015, with construction starting in spring of 2015. I wasn't going to say it, the minister did, with some kind of opening in 2018. So there'll be a number of stops along the way there when we'll gather and celebrate milestones. I would think the next big one will be a groundbreaking ceremony when we actually get the shovels into the ground. So I'm now going to call on a number of people. It's going to take 8 people to unveil this sign. So joining me will be Minister Matthews, if you wanted to come up, Judy Wilson, Brian Penman, Graham Gobel from the Lynn, MPP Ted Chudley, Cindy Luno from the town, and people have mentioned the auxiliary here and how important they are, and I'd love if Dorothy Hagel could join us, the president of the auxiliary, to help us unveil the sign.